Hello everyone, I am Dr. Srinath, consultant neurosurgeon at Renova Hospital Company. Today I am in front of you to speak upon the topic of functional neurosurgery. The topic of functional neurosurgery comes when the patient who has difficulty in the normal function of the nervous system, leading to many difficulties in the activities of normal life. The most common functional neurosurgery aspect we should discuss would be the Parkinson's syndrome, or when the patient has uncontrolled involuntary tremors of the hands and feet, followed by other symptoms such as difficulty in walking, difficulty in speech, and gradual decrease in the mental functions of the brain. So when we encounter such patients, usually the first line of treatment will be medical management, and there are various medical management methods available with different types of drugs which are available, which can help the patient in the initial stages of the disease. Therefore, patient can be relieved of his symptoms in the initial stage. When the disease, as it is progressive because of the age and duration, over a period of time, the symptoms tend to come back in spite of medical management. In such patients who don't have other comorbid conditions are appropriate candidates for surgical management of this condition. In this treatment, the procedure which we do is called the deep brain stimulation, where the patient undergoes surgery where electrodes are placed in certain aspects or certain locations of the brain called the substantia nigra, or the area of the brain which is associated with the control of smooth movements of the hands and legs. So when electrodes are placed in these areas, the electrodes are being attached to a battery system which appropriately stimulate the area, leading to improvement in the overall control of the motor system or the smoothness of the movement of the hands and legs. This will lead to improvement in the symptoms and also improvement in the quality of life. Over a period of time, such patients, if they are successfully managed with deep brain stimulation, will need to be followed regularly with their neurologist, and if the symptoms are recurring, condition of the patient should be reviewed, and it also requires maintenance of the system of the battery, which needs to be replaced once every 4 to 5 years depending on the use of the battery. So the next important function which can be helped with this deep brain stimulation is the essential tremor. This essential tremor is usually encountered in young patients where there is no particular cause associated with the abnormal movements of the hands and legs. Therefore, it's called as essential tremor, and such patients also improve with this procedure. And the next important clinical symptom which is helped by this is the obsessive compulsive disorder. Is a psychiatric problem where the patient keeps repeating certain types of habits in spite of not requiring the habit for normal life. Therefore, it's called a obsessive compulsive disorder. In this obsessive compulsive disorder, the cingulate gyrus is the area of interest, and therefore if it is manipulated and managed with the appropriate placement of the electrodes in with the deep brain stimulation, again this condition can be relieved without the help of medication. The other important types of functional neurosurgery are the surgery for spasticity of lower limbs, where the patients with problems like spastic paralysis, hereditary spastic paraplegia, or cerebral palsy sometimes can be helped with placement of a baclofen pump or a gradual delivery of the drug, which is the lyofen, directly into the spinal cord at a particular level of interest, therefore relieving the increased tone in the muscles of the lower limbs, and therefore allowing the patient to use his lower limbs in a normal manner, therefore relieving the symptoms. The other type of functional neurosurgery of late is a vagal nerve stimulation. In this vagal nerve stimulation, the treatment is usually done for the patients with epilepsy or drug resistant epilepsy, where both the vagal nerves, which are cranial nerves, are stimulated or isolated in the neck region, and the electrodes are placed around this vagus nerve and connected to a battery system which regularly stimulates it. So therefore this system usually directly does not relieve the symptom, but indirectly it controls the center for in the brain, therefore relieving the patient of his epilepsy condition. Any such conditions usually are initially managed by neurologists, and therefore if they are resistant to the treatment, they are suggested to go for neurosurgical management. Thank you.